International AIDS Society, and he told me that South Africa needs to be applauded for the way that they've handled the HIV/AIDS crisis in the past couple of years. Now, on that positive note, I've got with me the Minister of Health, Motsoaledi. Morning, sir.
Good morning.
Now, good accolade coming from this international conference that we've got, but what more can we do?
Well, let me say we are happy about that, because it's only 2 years ago that the president announced far-reaching protocols, new protocols on how to tackle the disease. It means we are heading there, but I must warn, there's still a lot to be done, taking from consideration that we regarded as the country with the highest burden of HIV/AIDS in the world.
Minister, what kind of impact is the fact that global funding has been cancelled? Where is this going to hit us the hardest?
It's going to hit the hardest on the NGOs in the country, which are getting funding from Global Fund to help the communities. The area which we might be able to handle is the purchase of ARVs, because we made sure that 90% of that budget comes from the fiscus, from the budget of government, and that's where we'll hold on. But as far as many NGOs are concerned, it's going to be a very dark period for them.
How do we keep the disease in the spotlight without the extra funding?
Well, we have been told long ago, 2 years ago, to try and be self-sufficient, and South Africa has been working toward that self-sufficiency in as far as fighting the disease is concerned, that we should not really put our full dependence on outside donors, even though they are very important. As I said, the biggest impact is going to be felt by the NGOs who were playing a supportive role to government. But all the doctors and nurses, technical people they've hired, will be able to absorb that.
Minister, on record this week, an increase in the HIV prevalence in pregnant women, particularly women in the older category. Could you just explain to us why younger women seems to have stabilized, yet in older women there's the increase?
Yes, the increase is mostly for older women, but all in all, the total study shows that it's still in the area of stabilization, as it did 5 years ago. That is, it has now reached a plateau, but there is a lot of stability on younger women. We think we have got two theories about what we have noticed. Firstly, that because those are the women who are on ARVs, it might be that our ARV program is starting to catch up, because prevalence measures the number of women the number of people who are positive at any one time. And if they live longer on ARVs, and we've got evidence that mortality, by the way, from HIV is starting to drop.
Minister, the second... Can I ask you just to hold that thought? We're running out of time. I need to bring in Mr. Korbaza here. He's from the Eastern Cape AIDS Council. So civil society, you represent them. What role do you play, and who are you?
In the AIDS Council, we are faith-based organizations, community-based organizations, all the non-governmental organizations that are participating in the fight against HIV and AIDS. And
the biggest challenge you face at a provincial level?
I think it is one that the Minister has already alluded to, the issue of funding. And it is going to be a problem going forward, as you understand the recent decision by Global Fund is going to give us a problem, because these are organizations of people who are coming from communities who do not have work. They are brought in just to do their voluntary work and do their support in terms of supporting the government in the program and supporting the people living and affected by HIV and AIDS. And these are organizations that have no other base in terms of a source of funding.
Being at local level and provincial level, do you feel that your voice is heard?
It is. I would strongly say that our voice is heard, because one of the things that we are doing as civil society, we are serving in high structures of AIDS Council in this country and in the province. We are leading subcommittees of AIDS Council that have a voice and that are bringing change and quite suggesting some important things in the AIDS Council. So I would say that our voice is really heard.
Thank you very much. Minister, could you give us any indication of perhaps what President Jacob Zuma will unveil today? Any new changes?
Well, what we have done is we have looked at the previous strategic plan, 2007-2011, and looked at the gaps. And he will be mostly filling the gaps in terms of treatment, in terms of rights, in terms of prevention. We'll be more moving forward in that direction.
Thank you so much for joining us, both of you. Much appreciated. That's all from us for this crossing, but stay tuned. Lots more coming from Port Elizabeth later in the program.